All right. Thank you everyone for joining me. It's the start of the month and we're going to start with the new IEP series. We're going to talk about today, what is an IEP and when is a 504. Next week, we'll get into the process of an IEP, followed by the parents' rights, and then we'll get into, at the very end, about school supports and placements, as well as an open forum for question and answer. If anybody has any questions as we're going along, please feel free to put it in the chat and I'll get to it at the end. And please don't be offended if it's a question that I'm like, I'll cover that at the next one, or I don't have an answer for you. I need to think about it. Let me get back to you with that information. My name is Natalie and I am the Academy Director here. I've been working with CPTWC through the Academy since August of 2023. I've been a BCBA since 2004, so I've been a BCBA for 20 years. Prior to working at CPTWC, I was a center manager for another clinic, and then previous to that, I worked at a therapeutic day school in Chicago through Easter Seals, where we did lots of IEPs, gone through a lot of the placement programs for getting kids into the therapeutic day placement, as well as next steps for transitioning out. So I'm going to start this process. Some of you, thank you for filling out the survey thus far, have already gone through the IEP process. So some of this information may not be at the level that you need, but it's also a good refresher as to know what exactly is included in an IEP, where your rights lie within those processes. So the first thing that I want to go over is kind of discussing a quick law review. So under the IEP process, it falls under the Individuals with Disabilities Education Act, the IDEA. It's a nationwide special education law that gives rights and protections to kids with disabilities. This covers students from their birth all the way through their high school graduation or the day before their 22nd birthday. So it kind of covers them through their lifetime for whatever comes first. Some kids will only need these supports and services and rights and protections until they've graduated high school. Some may stay in a school placement until the day before their 22nd birthday, so it'll cover them for that. Likewise, with this, under this law, you as a parent or guardian also have rights. Rights to protect your own kid with disabilities as to what services and supports and school placements that they require in order to help them succeed in school. So it's a nationwide law. So even if you move to a different state, even if it's mid-year or it's at the beginning of the year, that IEP will transfer across state lines. So the school that you go to has to honor whatever that previous school has written into the IEP until they can get to know the kid and do their own assessments and observations so that they can make recommendations or modifications to that IEP, or say that a school placement, does not offer something that is written into the IEP. They can come back and say, our school placement does not have that, so we need to amend the IEP or figure out a way to cover that. So in theory, if you're moving at any point in time, once you have that IEP, they're required by law to honor that IEP until it can be amended and changed. Early intervention is also part of the IDEA because IDEA covers from birth until high school graduation. So all of these policies and procedures are interconnected. In theory, the transition should be easy to go from early intervention into a school system. It's relatively new. I mean, it's been around since 1975, and it was last updated in 2004. So it's been 20 years since it's been updated, but it's still a relatively new process that's learning and growing for us each and every day. So what exactly is stated within the IDEA? Public schools, notice that I did not say private schools, it's public schools, must provide free and appropriate public education to kids with disabilities, and the learning must occur in the least restrictive environment. We'll get into the least restrictive environment a little bit later in the presentations towards the end of the month, but this basically means, where do they need to go that is the least restrictive for them to make that progress and their goals and succeed in their education. For each child, their least restrictive environment may be different. Schools must also find and evaluate students who may have disabilities at no cost to the families. So any of the evaluations that you go through the IEP process, they're not going to charge you. They're not going to expect you to pay for anything. It's all paid for through the public school system. We'll get into more about the child find later, but one thing that I do want to bring up is situations in which the schools would not want to bring up concerns to the parents. And it's not necessarily that they feel that the kid doesn't need the support and services. Many times they want to do a full evaluation and figure out what exactly is happening, how best can they support them without having to go to that step of having a full IEP. IEPs can be tedious and long and tiresome for both sides, the parents and the educators. However, that should, disbar us from being able to provide the supports and services that the kids need. Another reason why some schools may not choose to bring up concerns to parents is that maybe they don't know how to bring that up without sounding offensive to the parents. Sometimes when we're talking about behavioral challenges or challenges that kids are experiencing with regards to your educational abilities, some parents may, become very defensive or have excuses or state, I'll have a talk with them and things like that. So sometimes it can be very nerve-wracking for schools to bring up concerns because they don't want parents to feel defensive. We all want to come together as a team to help support this kid and in their journey and their educational placements. But schools are required to give both the parents and the child a voice in their education. So you also have rights and protections, which are called procedural safeguards. We'll bring those up at I think it's the third IEP series in terms of what your parent rights are. But just know that there is a document that should be given to you during each of the IEPs. Even if it was an amendment, they still have to provide you with your procedural safeguards that indicates what your rights are for receiving services and an education for your child. Other important laws that impact our students is Section 504. So sometimes you'll hear things about like my child has an IEP or my child has a 504. 504s come under the section of IDEA of Section 504. It prohibits disability discrimination at schools that get that federal funding. So schools must meet requirements in order to remove barriers to learning. This is super important for young adults because the law requires universities as well to remove these barriers to learning. So this means that, your child, if they go off to a college or university, can still have those accommodations in college. Whereas IDEA only covers until the day before their 22nd birthday. So this covers for Section 504 covers them at a much longer time period, and you can still get those accommodations and modifications within the college school system if your child still needs them when they get to that point. And then there's the Americans with Disabilities Act, the ADA. This prohibits disability discrimination by schools, employers, and anyone who offers goods and services to the public. They all kind of work together intricately to ensure that individuals with disabilities are receiving the support and services that they need to be successful in their full entire lives. So getting into it, what is an IEP? This is an individualized education plan, and it's individualized for a purpose. Each kid should have their own type of education plan that meets their specific needs. It shouldn't be cookie cutter. It shouldn't be cut and paste. Even if kids have similar profiles to other kids, we really need to make sure that this is individualized to their specific needs. This is a program or plan that is developed to ensure that a child with an identified disability who is enrolled in a public school, not a private school, receives specialized instruction or services. This will include current levels of functioning, student goals, services provided, as well as the location of said service, their classroom settings, such as their educational placement, modifications and accommodations needed within the school setting. And if they're 14 and a half and up, they'll be eligible for a transition plan. This transition plan doesn't start until they're 14 and a half, because if you think about it, those are the students that are getting ready for high school and getting ready for thinking about post-secondary education or vocational work placements. So this transition plan starts to set the stage as to where that client is going to be going or doing and what supports they're going to need and how can we get them to that level and be successful. Your child has the right to a specialized instruction that allows him or her to make meaningful educational progress. This law also requires schools to provide what is appropriate or necessary, but it may also mean that it's not what is best. So that's where you come in as an advocate for your child, because you know your child the best as to what exactly they need in order to help make that educational progress. Lastly, it needs to be based on the most updated, most current recent information. So evaluations that have taken place more than 6 months ago would not be the most current or recent. We want to make sure that we're looking at data as well as evaluation results that are within the 3 to 6 month range. More sooner than that would be preferable, but sometimes for our speech or OT, they may not have done a more recent evaluation. So we want to look to see what is the most recent and can we send that in to be reviewed as part of the IEP process. Now, I mentioned earlier that this is for kids who are enrolled in public schools. That's because public schools are receiving state and federal funding, so they fall under that federal law of IDEA. Private schools, for most of them, do not receive public or state or federal funding. They're receiving private funds in order to fund their institutions, their education, their teachers, and things of that nature. So they are not required by law to provide IEPs and thus IEP services such as speech, OT, PT. There are a few schools within Chicago that are private schools who may contract out with other providers such as speech, OT, and PT in order to provide that service when it's been identified that that client requires it, but they are not legally obligated to provide IEP or any of the provided services that fall under the IEP. So that's something to keep in mind when you're looking at schools, that if you choose to go to a private school placement, your child may not receive some of the supports and services that they need because they're not legally obligated to provide them. So keep that in mind when you're kind of thinking about what is best for your kid in terms of educational placement. And then what services can be provided with an IEP? So that, whoops, let me go back. There we go. Nope. What services can be provided with an IEP? So IEPs versus 504, which we'll get into next, are quite different. Your IEP services are looking at not only at your educational placement, but what other services can be provided. So first, number one service that can be provided is special education classroom. And then looking at your paraprofessional, this is your one-to-one aide, or maybe it's a shared paraprofessional. Shared paraprofessionals are shared amongst a couple of kids within the classroom, or they're provided during certain time periods where the client needs more assistance. Maybe there's more behavioral challenges that are creating a barrier for them to access their education. So when you see shared, it basically means that they are sharing that paraprofessional with another student in the classroom, and it's provided during certain periods of the time. So it's not a one-to-one, this person's directly tied to me, I have them with me at all points in time. Speech and language and physical therapy are all provided as direct and indirect services. Indirect services are consultation, so consultation with the teacher, consultation with other providers. Direct services can be provided in a group or individual, and it could be provided in the classroom or a separate classroom. Occupational therapy is a little bit different. They still do direct and indirect services within the school system, but it cannot stand alone in the IEP. So you can't have an IEP that just lists occupational therapy as your service. You'd have to combine it with another service such as OT, PT, speech, or social work in order to have that. I'm not for sure why that is required, but that is the only therapy service that is required to be aligned with another one in order to be provided it on the IEP. Social work could be direct or indirect services as well. And then psychological services, mobility services for individuals who have physical disabilities, health and nurse services, so kids who take medications, or maybe they need to be, they have a G tube that needs to be monitored during their feeding sessions. And then interpretation services for kids who have English as a second language can also be provided within an IEP. You have to have one of the following diagnoses under IDEA in order to get an IEP. So, individuals who are neurotypical in nature would not probably align with an IEP unless they have a diagnosis listed below. So a specific learning diagnosis, other health impairment. So ADHD is under this, but there could be other health impairments in terms of seizures or G-tube or things of that nature that would impact or create a barrier for their learning. Autism spectrum disorder, emotional behavior disturbance, speech or language impairment, visual impairment, deaf, hearing impairment, or deaf and blind, orthopedic impairments, intellectual disabilities, traumatic brain injuries, as well as multiple disabilities. So if your client has one of those, they may be eligible to get an IEP through the process that we'll go over. Adverse effects is something that they talk about, not only from our perspective, we also talk about adverse effects in terms of medical, but within the school, you can't just have a diagnosis. So even though I just went over and said you have to have the diagnosis, it may not be enough to qualify for an IEP. There has to be adverse effects of the disability on their educational performance. For example, excuse me, you could have autism spectrum disorder, but it doesn't impact your ability to transition, go through, your day-to-day, you don't have any challenging behaviors. Maybe you have some concerns with regards to your social ability to, connect with others or start conversations or things like that. But it could not rely on an IEP. Maybe a 504 would be more specific to that nature, that they don't need full-on IEP services. They only need some modifications and accommodations to meet their needs. So we have to go through and determine, is this disability causing an adverse effect on their ability to transition and access their educational placement on their own individually? So how do kids go about and get their diagnoses? Obviously, you can get an outside evaluation. So many of our clients that are here have already gone through the process of obtaining their medical diagnosis of autism spectrum disorder. Or maybe there are other health impairments that they have gotten that diagnosis done by a medical professional. Schools will recognize these diagnoses from the outside evaluators. So if your child's already gone through that and it's been done by a neuropsychologist, or maybe your client has had a full neuropsychological evaluation and it's been found that they have ADHD in addition to their ASD diagnosis, the school will help to provide them with an IEP. Also, schools can also provide that diagnosis. So if your client does not have one completed by an outside evaluator and you're concerned about how they're going to do within a school setting, and you're not sure if they are diagnosed with something, but there are some barriers that you're noticing with regards to their ability to be independent within an educational placement, schools can provide that diagnostic. It's important to note that the criteria of the diagnosis in school is different than what we're used to, because they're looking at it from an academic standpoint rather than looking at it from a medical diagnosis. So for us, we look at the medical diagnosis because that is what we are looking for in terms of insurance-based services. Insurances may require certain diagnoses in order for us to provide certain levels of services. Whereas the school is looking at it from an educational standpoint, what is their academic diagnosis that is creating those adverse effects for them to access their education independently. So it's a little bit different. You couldn't go, take your school educational diagnosis and use that to get medical services. That would not be accepted. But on the flip side, the school will accept anything that's been done by a medical provider with regards to a diagnosis of your child. So we're kind of in the same, standpoint where we need to have a diagnosis in order to receive any type of services, whether it's through therapy with us or within the schools. So flipping the stage, we're going to talk about a 504 service. So 504s are a bit different than IEPs. Some parents have joked around and called it the IEP light, because it doesn't have full rounded services as what an IEP can, provide. So this is really looking at providing services and changes to the learning environment to enable the students to learn alongside their peers. Direct services cannot be provided under a 504 with the exception of social work. That is the only one that can be provided under a 504. So if your client has an ASD diagnosis, and that is the biggest barrier for them to be able to access their education, but speech and language, they're okay. OT, PT, they're okay. Everything educational, they're at the level of their typical peers, or maybe they just need a little bit of help and redirection. Maybe they just need a 504 to receive those social work services to help work on some of those social interactions and conversation skills. It's for students who need certain modifications within their school environment. They're not as restrictive as IEPs, and they do not provide specialized instruction. So again, it's just looking at what accommodations or modifications are needed for them to access a learning assignment or learning placement alongside their typical peers. It does not, count for I need speech in order to help work on my language impairments. Or I have ADHD, but I also need OT to help me work through some executive functioning skills, in addition to social work to help me work through social emotional issues I may be having with regards to my ADHD diagnosis. Generally, a 504 is for those clients who can function in a general setting, but they just need a few accommodations to help them. When a student is being excluded from an activity due to a disability, a 504 plan is needed because it's going to provide those accommodations and provide those supports to help them access both the academic as well as their extracurricular activities. So this is kind of nice in terms of a 504, is that it can go for both academic and extracurricular, but it also can travel with them all the way up through high school into their college university settings. Accommodations don't change what the child is learning. It just changes how they learn it. So that's another indication of the difference between an IEP or a 504. IEPs are looking at how do we need to make changes on how they learn things, whereas a 504 is how can I help them what they're learning about and how they're learning it. The goal is to remove the barriers and give the kids access to that learning. So what can be provided within your 504? So some examples are preferred seating. Maybe your client has ADHD and they need to be seated close to the teacher so they're more attending to whatever's happening. Or maybe they get frequently distracted by looking out the windows. Maybe they need to be seated more in central as well as up to the front, so that they're closer to the board, closer to the action of how the teacher is teaching within the classroom. Maybe they need extra time on tests. This includes not only just tests given in the classroom, but also tests that are more statewide, or even your SAT, ACT exams that you need for college entrance. Maybe the person needs speech to text for writing, so they have a real difficult time writing down the answers. Maybe they need to use the computer so they can better type, or maybe they use a device that they can use to speak into it and it'll write out their answers. Modified textbooks is another modification that can be provided. So instead of being able to read what's written in the textbook, maybe it's provided through audio because the client learns better through audio responses. Or likewise, having the text read to them. Maybe they struggle with the comprehension of reading the question, but when they hear it, they're able to process it a little bit different, given an auditory processing disorder. Sometimes they'll provide testing in a different room, or maybe it's not provided in a different room, but it's provided at the back of the room or in smaller groups to kind of help lessen the amount of people that are present to reduce distractions while taking a test. Movement breaks are also an accommodation. Kids who take medication during the school hours will also need a 504 because they need nursing services to go to the nursing office to receive their medication. Can even be written for those who are returning to school after postoperative care. So they broke their bones and they have some temporary physical disabilities and they need to use a wheelchair or crutches. So they need extra time to transition between classes. They need to use an elevator or some other modification in order to get to and from. Maybe they need to have a person push them. So they need to identify an aid, so to speak, to help them get to and fro from school classrooms to classrooms. This would be a temporary 504, but it is in duration to help them during this period of time when they have a physical disability that's temporary. For kids who have other health impairments such as diabetes, maybe they have a certain time period where they need to be provided a snack so that they can help level and keep everything regulated for their glucose levels, as well as maybe they need to leave the classroom to receive an insulin injection. Other, things that could be provided through a 504, maybe they need frequent bathroom breaks. They need to get out. So movement breaks are an option, but maybe they need to go out into, the bathroom to take a bathroom and not have to be asked 50 questions as to why they're going to the bathroom. Others can also include, checking on the client, tapping their desk to make sure they're paying attention, checking in with them at the end of the classroom period to make sure that they wrote down their assignments and they understand the information that was provided to them. So providing those check-ins with the client to ensure that they understand what is expected of them. So again, this is not full services. These are things that are just accommodations and modifications to help them access their learning environments. So when will we refer a student for a 504 versus an IEP? When the student does not require specialized instruction, but does need to have access to that public education, we would provide only a 504, or we being the schools, I should say. But when a student requires specialized instruction to access as well as to progress in that educational curriculum, then an IEP would be needed. This also includes if they need specialized services such as speech, OT, PT, things of that nature. Because again, the 504 can provide services for social work only, but if their disability is far more impaired and they need access to other services in order to help them progress in that educational curriculum and access it as well, they would need an IEP service so that they can further their learning and growth. Also to note, with the 504, there are fewer procedural safeguards in place for them as it compares to an IEP. So 504s are covered under the Section 504 of the Rehabilitation Act. And under the civil rights law, students have the right to free appropriate education. And that's the whole point of the 504 plan. It's to give them access to the same education that their peers are getting. And this also is guaranteed under the special education law on DAA. All right. Before we get to questions, I wanted to show you guys a quick process. Now, some of the stuff we will get into, I'm not going to go too far into this fact sheet because some of the process we'll be talking about next week of, okay, this sounds great. Now I know my kid needs an IEP. What about it? How do I get there? One good resource that I highly recommend parents just having in their back pocket, whether it's to, formally access or just to keep in mind, is Equip for Equality. So this is a legal advocacy program that provides help, tips, as well as also can help you in a due process agreement or things of that nature if it ever should get to that way. But it's not just for special education. They provide legal advocacy for people who are in the workplace with regards to ADA. So they really try to advocate for individuals who have a disability, whether that's in the school or workplace, to ensure that they're accessing everything that they, are legally required to under the law. So the IEP process, we went through, what it is and things like that, but I wanted to kind of break it down in terms of the parts of the IEP. We'll kind of get into some of this a little bit later, but this is just kind of a grand overview to kind of know what to expect with regards to the parts of an IEP. 504s are much different. They don't have all of these bells and whistles. It's mostly just kind of what is your kid's name, what's the diagnosis, what modifications do they need, what has been tried. So it doesn't really look at most of these pieces. It's only looking at, what is wrong and how can we kind of fix it. The first part of your IEP, besides, looking at the current levels of performance in terms of evaluation reports and things like that, you're going to break down that present level of performance into different parts. So you're going to look at the recent reevaluations or evaluation. It should include the name of the test that was given, the dates of the test, their performance on it. It should also look at the results of most recent state and local testing. So if your client is in the state of Illinois, there's certain required tests at certain grade levels that they have to participate in. And then there's also local school district required testing, such as MAP or things like that, that goes into, how are they performing as it compares to the peers within their own grade level. So look at that. For your first initial IEP, you will not have that because we do not do state or local testing. So we would not have those results, but they would have for your IEP recent evaluations or reevaluations that we can provide, as well as on their own when they go through Child Find. You also want to have a statement about what they can do in each specific area. So for each present level of performance, you're looking at each area: English, math, social studies, science, independent functioning, those type of areas they're going to look at, and they're going to tell you where they're at, like how are they doing in this specific area. But then they'll also, on the flip side, talk about the struggles that the client is having within that specific area. How does their disability affect them in this specific area? And then what supports or interventions have been tried to ensure that they are, learning and growing and making that progression. Likewise, we also want to know what hasn't been effective and why in terms of the sorts and interventions that have been provided, because we want to know, what have we tried to do to mitigate this barrier and why did it not work? At the IEP meeting, if you think of the statement of a present level of performance is not specific, then you can ask the team to discuss further points and include them in the IEP. At any point in time, do not be afraid to voice your concerns. I know it can be extremely scary. I've been on that side as my daughter has had a 504 since the second grade. And I've been through many IEP processes for both my clients as well as my students at IEP Series. It can be an extremely scary piece to look at everybody in that process and see what is happening. But your child, and you can bring anybody to that IEP meeting to help advocate for what that person needs. So if you feel that some of this stuff is not mentioning the strengths as well as some deficits, that is the time to speak up and provide that information to better shape and mold what the IEP process will be looking at. And I will be sending this out to all of you so you can kind of see this process fact sheet. You don't want to see them just say, oh, he's below grade level in a certain activity. You want them to flush that out as to, they're below this grade level. Here's some strengths that they're showing that shows that they're below, but they're still, doing well in this area in terms of these pieces. Here's the deficits. Here's some supports that I tried. Here's some supports that have failed in that process. Other things are annual goals. So one thing to look at with regards to annual goals is that it needs to be a SMART goal. So this is your roadmap for what your client will be receiving for this next year. So SMART goals are specific, measurable, achievable, relevant, and time specific. So it needs to address all of the unique needs of your child's disability. It needs to be measurable, like how do I know that they've actually attained this and achieved this? Must be achievable. So it has to be, challenging, but not too challenging that we're reaching for the stars and there's no way in the next year they're going to be able to meet it. But we don't want it to be too achievable that they've met it within the first 3 months of school. We want to have a healthy balance between the two. And then relevant, does it make sense for your child? And then time specific, what should they be doing that can be achieved within that next year? Or if it's not within that next year, the goal specifically states, what is the time period that we'll be working on this? And then I'll also include your services. So in each service will have their own goal that they will be working on to achieve. Usually within the goal, you'll see 3 other different spots. So you have a larger annual goal, And then you have benchmarks that will be met every quarter. So the benchmarks must relate to the goal, even if it's like this overarching goal. The first benchmark, okay, well, this is the baby step that we're going to do to achieve that goal. And here's the next step to achieve this goal. It looks at all of the different deficits that they have and how it relates to that area and how are we going to help them achieve that. And then services, we need to make sure that it's indicated for how many minutes per week they'll be receiving it. What will it look like, whether it's within a group or within individual one-on-one speech therapy, as well as, if it's consultative, there should be a consultation goal. So it's just something to kind of like relate to, but it should be very specific as to what they're being provided within the goal. Sometimes you'll have, flexibility in terms of like this kid's going to get 60 minutes of direct. It could be within a group, it could be individual. So that provides a little flexibility to the therapist that if they walk into the classroom and the kid is involved in a group activity at that point in time, this might be a good time for me to push in and provide my speech services, as well as that flexibility of I need them to go into a more controlled environment. I need to provide my speech therapy services within an individual room versus a group. So that's something very different from school-based services, is that they have flexibility as to how they provide their services, as well as the minutes. Whereas here, if a kid was getting 60 minutes per week, it probably would be full 60 minutes right there. Whereas at school, if a kid has 60 minutes, they could break that up into smaller increments of time so that they're seeing them more frequently at shorter bits to increase the opportunities, as well as to, provide help and support during different activities that the kid is accessing throughout the day. So that is kind of a nice thing about school services, is that you do have that flexibility to choose, how you're implementing your goals for the related services. And then modifications and accommodations, they're broken into two separate sections of the IEP, one after the other. So modifications could be, extended time, small setting, assign assistance for taking notes, large print books, books on tape, audiobooks, things of that nature. And accommodations are your supports. So you could be very creative in this regards of like how we're going to support the kid with meeting those needs. And accommodating them. So modifications are changing things, accommodations, how we're going to support them within that IEP process. And then another section is your placement. Again, we're going to look at the least restrictive environment for each kid. And each kid is going to be different as to what's identified as their least restrictive. So some kids, a general education setting could be their least restrictive environment. For others, it may be a residential placement that has a school placement as well. And that's the most restrictive placement for them. But for them, because of their needs and everything that they have, they would need that as their least restrictive. So again, there's a little movement in terms of what's determined as a least restrictive environment, because it needs to be individualized for each kid and their needs. Some schools may say, like, they can come to this school, but they're going to be in this type of classroom, and that's going to be their least restrictive environment. You should always, always talk about how are we moving them into another least restrictive. So if your client is starting at, the most restrictive environment, what are some plans and actions that we can work on in the next year to help bump them down to the next level that would be the least restrictive, and so on and so forth. So school districts and school staff should always be thinking about what is the next level that we can get for this kid. Even if the next year they stay within that classroom, but how are we making steps towards the progression of a least restrictive environment for that client? Excuse me. And then transition planning. Most of your kids are, of young age, looking at the survey results as well as looking at who is present. Most of your kids are going into pre-K, maybe even kindergarten. So this thought of transition planning is not even in your head at this point in time. You're just trying to get your kid transitioned into the school system. But know that once your child turns 14 and a half, or the year that they turn 14 and a half, the IEP team should start to consider transition services for post-secondary education or workplace employment. So the goal of the transition services is to prepare your child for independent living, employment, as well as further education, whatever, is going to be their goals and their achievements based on how well they're doing within the school. So that's much larger of a process, but it does fall within the IEP. And usually there's a transition planning person that will come in to help support and offer up different ideas, as well as to you, like, here are some services that you should be aware of to get you going within that process. If your child exhibits behaviors that affect their learning and as well as the learning of those around them, they may qualify for what's called a functional behavior assessment and a behavior intervention plan. Sometimes with newer clients going into the IEP service, they may not know whether or not they're going to need that level of service of a behavior intervention plan. So some of your kids may be going into school without that behavior plan until they get in there and they're able to assess and evaluate and observe what is happening to see if they need to add that piece in there. Some of your clients, because of the support that you're having with your ABA therapist, your PCBAs, they may come prepared and let them know that, yes, we're going to need a behavior intervention plan, and here's what we're doing. What as a school are you able to provide and continue on with this plan of action? So some of the kids may need behavior intervention plans, and some of the kids may not. So it's not a requirement to have one in there, but if their behaviors are to the level of interfering with their own access of learning, as well as those around them, or it's a safety concern, it's causing, harm to others, themselves included, then we would probably need to have a BIP so that we can address those behaviors. Another service that should be considered is that if they are of, English is a second language and they have limited English proficiency, we should probably have a team consider those needs and put that into the IEP. If your child is blind or visually impaired or deaf or has any hearing impairments, this should also be considered with regards to how we're providing instructions, as well as how we're helping them to communicate their wants and needs. And then likewise, a lot of our clients use here assistive technology. So this will be listed under an accommodation to help support them. Within an IEP, oftentimes they'll just list it as assistive technology. They generally will not and should not list out the device name. And I will tell you why. If a client goes in and their goals indicate, as well as their accommodation indicate that they are using the LAMP system of assistive technology, if something happens to their communication device and they're no longer using LAMP, you have to go back and revise that IEP. So we want to be general in what we're stating, so we're not totally locked in the IEP, and we can make those, changes fluidly rather than waiting and coming back to the team and making a change in the IEP. Because if something happens to that device and they're no longer using LAMP, now they're using a Dynabox device or some other type of communication device, we would have to make a change in the IEP and wait until we can get the entire team together in order for that kid to access that new type of device. So by keeping it more general, it allows that fluidity so that you can make changes to whatever device they're using without having to come back together as a team. Assistive technology does not also, just normally include your communication devices. It's looking at other types of assistive technology that may be recommended by a PT or OT to help them access their learning environments. If your client uses pictures to exchange, we wouldn't call it the PECS system because maybe, there's a person that's not fully trained on the PECS system. So again, using more general language to help the client be able to access what they need within their learning environment. Okay, and we'll get into the IEP team during the next one where we talk about the process, who you can invite, who can be present, what role do they serve, and things of that nature within the IEP processes. So we'll get into that, but I definitely am going to share the process fact sheet with all of you guys so you have access to that so you can review it on your own. I will also send the information for Quit for Equality so you have it in your back pocket. They're super nice. Sometimes they're super busy and they don't always get back to you as quickly as possible, but they do have a number that you can call just to have questions. I have this situation happening, or to send an email, hey, this is what's happening. someone will call you back and contact you, walk you through that, and they'll make that determination of whether or not they need to help you in terms of legal advocacy. Sometimes they'll just call you and give you, hey, I don't think at this point in time we need to get involved legally, but these are your rights and this is what you should do. And this is what you should note during the IEP when you request it, or 504 if your client would fall under those things. So note that there is help and support out there for you guys, as well as advocates who can help you better understand the IEP law to ensure that your client is getting what they need once they transition to full school services. On our end, we've already created a spreadsheet based off of BCBA's as well as the OT, PT, and speech team in terms of who has been identified for those transitions out of CTCA and into the school district, so that we're helping to guide you guys as well as listen to what you have and need, so we can better support you. Whether that is, I need the evaluation reports, I need somebody to come with me to the IEP to help advocate because you see this kid every day in the classroom, whatever it is, we're helping you to provide that as much as possible. If you are curious if I have your client on my list, feel free to send me an email to ask, or if you're like, we're in the thick of it, we're in this process, and I really would like some guidance, feel free to contact us and we'll be happy to set up a call to kind of walk through any of these processes with you further than what we're doing here during these IEP series. So I'm going to bring this back over to any questions that you may have that can be answered. You could put it in the chat. You can also put it into an email if you're like, I'd rather, not talk about it amongst, 15 different people. I'm happy to answer it. Further, if you have questions that are going to come up later on, you can always send it to me ahead of time so I'm prepared and I can answer your questions there. So anybody have any questions? I hope this was helpful for you guys in terms of the first steps. Fabulous, Erin. I will look forward to sending those out to you to get a response. Anybody going through this right now that wants to provide any feedback or nerves and scariness?
Hey, Natalie.
Hi.
So one thing, I actually gone through the process and we actually got an IEP back on September. And it seemed pretty good, but then we opted out and then they told me I have to go and do it all over again.
Yes.
Like, why is that? Because they told me it's valid for a year, but then I think I heard you say something about 6 months. So I don't know if it's because of the 6 months or...
Yeah, so he'll get so what happens if you decline your IEP, then it's done. It's basically not here anymore because you have the paperwork to show, yes, I did have an IEP and I did have it. But if it's not active in the system, they're not actively, accessing any of the services that were offered within the IEP, then it's basically almost like, all right, parent wiped their hands of it. They said no to it, so we don't have to worry about it. So they would have to provide a new one a year out. So since school starts in, I think it's like late August or something like that. Yeah, they're probably like, might as well just do it versus him going in and being there, free in terms of running around and, not accessing his educational placement the way that he needs to. Probably want to have that before he gets there so all the systems are in place. Plus, like you said, their evaluation reports and things like that will be a year old. They'll want to review more recent data because maybe there's been some growth and some changes in different areas, or maybe areas that he was succeeding at previously, he's now showing some deficits, or maybe the deficits are a little bit different. So they want to make sure that whatever they're going to provide in the IEP, it's, for the most recent and current specializations.
But would they still use the old IEP, or it's just like completely like everything's just as if nothing ever happened?
I think they could still use the old IEP and go off of that and then maybe add to it and amend like, okay, this is no longer like looking at the modifications and accommodations, last year he needed all of this and now he's fine. Or the way that it's presented, is a little bit different. So making an amendment and revising that to ensure that, it's most up to date for what supports and things like that he needs. Same thing for goals and things like that, present level of performance. Some of the goals might stay in place, or maybe it's like, all right, he knows all of this from last year. We don't need to worry about this. We're going to move to the next goal level for him to access. So they could take information that they had from the previous one. What I've seen sometimes in school districts is that they look at the previous one and then they unfortunately ask the parent, like, what do you think? Is that something that you think we still need or something? And like, sometimes parents are like, I don't know, you tell me, he's coming into your school. But they're looking at you because you know the client the best. That's why it's helpful to invite anybody that provides, even if it's private services and things like that. So your OT, speech, PT, your BCBA, have your full people here so that they can help you. Also, when we go through the IEP process, I'm going to share out, there's a document that you can fill out to kind of give them a better picture and have it presented. And you can send it before the IEP to give that educational team a little bit more background as to, who your client is and what do they need to kind of help set the stage for a productive IEP meeting.
And so basically after you get the IEP, so it's always good to like, once you get the IEP, to just start within those first like 6 months and not like wait the whole year.
Yeah. And you can even like, there's certain, I don't want to say like certain parts you can say no to and certain parts you can say yes to, but maybe, school placement, like you said, I don't want to access the school placement because I'm not ready, or I feel like he's doing better here at CTCA. We're providing the supports that he needs, but I'm going to take him to this school that you've assigned him to, and he's going to access his speech. Like you could keep some of those therapies still going, so he's still accessing it at the district level, and things like that. But and even I will preface this, and I tell parents this all the time, because I think a lot of us as parents just don't realize that. We just think, all right, IEP is done. This is it. This is what I gotta, have for the next year until, it's time to review and update. You can call an IEP meeting at any point in time. So if after 3 months, your student is not doing well in the classroom, or, you feel that a new modification needs to be made, or maybe they're just not making, you met with the teacher for parent-teacher conferences and this goal is way too high and we need to bring it down a notch for the achievable part, you can call an IEP meeting and say, hey, I'd like to meet with the team to discuss this. The school could respond and say, we don't need to have a full IEP meeting for that. We're just going to pull in these certain people to make amendments to it. And, you as a parent can say, okay, that sounds good. I understand your reasoning. Or you could say, nope, sorry, I don't agree with that. I want my whole team there to kind of help support it. So it's you really, as a parent, drive that bus of that IEP. It's all in your hands to, navigate how it is, which makes it a really scary process for parents. But know that you have full control, full voice over that system. So if you're not happy with something or you're not seeing something, voice it up and make sure that it's heard. And at the IEP, you have time to read over it. Like, don't think that at the end of IEP, you have to agree to everything that's written there. Take time, because those meetings are long and everybody's talking and it gets confusing as to who's recommending what and what's happening. So I always recommend to parents, take that IEP home, review it in full, look at what is written down, and then come back to it and have questions. Or if you don't have questions, be like, okay, I agree to this. Let's go ahead and implement this. And if you don't agree to it, call the IEP meeting again. Be like, I don't agree. Here's the reasons why. I also recommend, and we'll talk about it next week too, everything must be in writing. So even if you talk to the teacher or the IEP team, I always follow up with an email. hey, thanks so much for your time. This is what we discussed. These are, recommendations that we're making to amend the IEP, or, even if it's like a parent-teacher conference. Thanks so much for what we talked about. I look forward to seeing the goals change. Let me know when it's ready to go and I'll call an IEP. Something of that nature. So you're documenting all of your concerns. So that if anything happens, you can be like, look, I, have asked, I've reached out for this support, or I've done this. Just so you have your ducks in a row. It's, again, pretty scary to have to think that way. But again, when you're having those conversations with a person in front of each other or on the phone, it becomes he said, she said. That way you can document in an email or letter what your concerns are or what you need.
Okay, thank you.
Yeah, no problem. Anybody else have any other questions or anything? All right. Well, I look forward to seeing you guys again next week for the actual IEP process and who you can invite and all of that nature of what it looks like. Again, I will share out the recording and get everything part of the presentation slides, as well as that IEP process fact sheet to you guys so that you have all of that. If you have questions, you want to send it my way, feel free to email me and I'd be happy to answer it. Otherwise, I hope you guys have a great rest of your day today.